Hello, and welcome back to the Medicare Team podcast. I'm Josh,
And I'm Sean.
and we're here to break down everything about Medicare for you. How's your week been going, Sean?
It's been going pretty good, honestly. I had a client a couple days ago that I was able to help out. Basically, the situation was she was on original Medicare, which means she just had Part A and Part B. She didn't have any advantage or any supplement plan in place. So we took a look for her, asked her some questions, tried to kind of gauge, what would be the best option for her.
And that's also super concerning if she didn't have anything past her Part A and Part B, because that leaves her open to a lot of variables and a lot of different costs that could hit at any time.
Yeah, and especially when someone's on just original Part A and Part B, it can be very, random, and how much you have to pay with some of those co-insurances. So we were actually able to verify that she had full Medicaid and get her on what's known as a dual eligible special needs plan. So we got her completely helped out. She's going to have $0 copays for a lot of her services, and she also gets some additional benefits like a food card each month that she can use to help pay for groceries and things like that. So it was a really good situation where, she needed some help, and we were actually able to help her quite a lot there. So that was very satisfying.
So she went from being on the hook for, what is it, 20%
Yep.
of your medical care, which it's uncapped, so
hmm
it could go anywhere,
Yeah.
to having her medical care almost fully covered, essentially.
Fully covered, pretty much. Yeah, and like you said, with that 20%, I mean, she gets billed, say, $10,000 for hospital bills. She has to pay $2,000. So, it's
Mhm.
very, very, the stability there is just not really completely there. So we got her on, like I said, that dual eligible special needs plan, and now she has all those $0 copays. So we helped her out quite a bit, which it was very nice to see her go from such a high cost to now such a low cost.
And I'm sure part of that for her was nobody really explained Medicare to her,
hmm
explained her options to her. And oftentimes people don't know where to go with questions. And what a way that can bring up a lot of concerns for people when they just don't know that these things are not only available to them,
hmm
but they're entitled to these things, especially if they have something like Medicaid. There's so many of those dual eligible special needs plans that are ready and there for people with Medicaid
hmm
just to make sure that their medical expenses are taken care of and make sure they have that support when it comes to things like dental and vision and hearing.
Exactly. And especially in her case, she actually wasn't even aware that she had such a high level of Medicaid. So for her, not even knowing, she could have just stayed where she was at on just original, Part A and Part B. But, her talking to the agents that we have here, and, thankfully we were able to help her out. And like you said, get her all those $0 copays. So, even if, in her situation, she doesn't necessarily know all the benefits that she has. That's why it's really important to, talk to an agent, and we can actually help her take advantage of those benefits.
And I get excited when I am speaking to somebody and they are on, a plan that doesn't have Medicaid to it or is not a dual special needs plan. And I see that they have Medicaid
hmm
because I can then help them exponentially. I can take care of them, and that's going to change somebody's life. Their quality of life is going to go up. It's going to
hmm
help their health. It's going to help their wallet.
Yep.
So it's
Extra money.
important that people know where they can go to ask these questions and someone that they can trust to give them the proper answers,
hmm
which is why today our topic is actually going to be answering, your Medicare questions. We want to make sure those little questions that you might have that you just don't know where to go with it, kind of what we're going to talk about today.
Yeah. And I think a good one to start with, one that I hear a lot is, how does coverage work with my spouse or with my partner?
Hmm.
And I think it's really interesting there because, when it comes to Medicare, whether you go the Advantage or the supplement route, you are going to need to individually sign up. Certain plans, for your wife, it may work well. For you, you may need a different plan with different benefits and different copays. So, it is very important that every single person individually, talks to an agent and has them help them assist get on one plan.
It's kind of like getting fit for a suit because everybody's going to have a little bit of different needs. Like you
hmm
were saying, some people might need more coverage when it comes to seeing their doctors. Some people we speak to every day, they need dentures,
hmm
but they don't have coverage for dentures. So we can find them plans and opportunities that are going to maybe fully cover those dentures or at least help them a good amount in those.
Exactly. And to touch back, that's why it is important that you do it individually.
Mhm.
Your husband may need, like you said, dentures, but you may need, hearing aids or, glasses. And so we might find a plan for him that covers his dentures, and we might find a different plan for you that helps you cover those things that you need too. So that's why it's very important to, individually sign up and make sure you both are covered.
Yeah, speak to an agent and look at your needs. Talk
Hmm.
about your medications, talk about your doctors, and make sure that whatever plan you want to get into is one that's going to be tailor fit for you. There probably won't be something that's absolutely perfect, and nobody's going to have a perfect plan,
Hmm.
but there's going to be things that will take care of you better than others. So it's important to kind of see those opportunities. And a lot of people are turning 65, they're getting ready to retire. And with that, they might have that employer insurance, that employer coverage, and they might be wondering, how does Medicare coexist and interact with my employer
Hmm.
coverage? And are there still gaps in that coverage?
Yeah, and that's a great question that we hear a lot. And as far as gaps go, it's really tough to say. You know what I mean? Everybody has a different plan. Certain employers have different coverages and whatnot. So it is important that you talk to an agent. We can see, maybe there are gaps in certain areas that we could help you out with. If not, then if you can stay with that employer coverage, that's something we would want. But yeah, just talking to an agent, kind of, trying to figure out those gaps, if there are gaps, and how we can help provide additional coverage for those gaps.
And not only that, but the opportunities you have to possibly stay on that coverage. Sometimes the employees, they offer people to stay on those past retirement.
Hmm.
And sometimes they don't offer that. And once you retire, you're kind of on your own.
Yeah.
So it really changes up your insurance and what you've had for a long time. So it's important to talk to a benefits coordinator or whoever at your office or at your company handles the benefits and see what's being offered. And especially if you like the cost at it.
Hmm.
Because if you want something that's at a lower cost, maybe a Medicare Advantage option, which are typically those $0 options would be great.
Hmm.
But if you still want that comprehensive care, but maybe at a lower cost, something like a Medicare supplement plan
Yeah,
would
might be
actually be
great.
great for people. And looking at that, what do you Sean, what do you think the differences are really between the Medicare Advantage plans and the Medicare supplement plans?
Yeah, between the two, I think the biggest differences are cost and coverage. Obviously, Medicare Advantage, like you said, are going to have, most Medicare Advantage plans have a $0 monthly premium. With that, they do tend to have slightly lesser coverage and, some gaps within that coverage. Whereas the Medicare supplement side of things, obviously, like you were saying, it is going to have a much higher monthly premium. But with that, comes the more comprehensive coverage. So it's all just about, talking to an agent, letting them know, your needs, how you plan to use your health insurance moving forward, and, kind of letting them gauge, how you're going to use this and what might be a better fit for you between those two.
Absolutely. And right now, the average premium for Part B, what is it? Is it $202 a
Yeah,
month?
I believe it's $202.90 a month for Part B.
And for a lot of people that might not think they need coverage, there are things in Medicare Advantage, like the give back plans that go
Hmm.
to help pay that premium so that you're not taking on all that cost for yourself, especially if you're not super concerned about your medical care right now, or if you're generally healthy, you don't really see doctors and
Hmm.
you don't want all that extra coverage. Those give back plans are fantastic for people.
Yeah, and just like you were saying, if you are relatively healthy, you don't really see that many doctors in a year, you don't take too many medications, then, like you said, maybe a Medicare Advantage side is a better option where you can sign up for, like you said, a give back option that helps you kind of reduce that Part B premium each month. Whereas, if you're someone that's very unhealthy, you're prone to a lot of, chronic conditions and things like that, then maybe a supplement is a better option. You know what I mean? You have more coverage, you'll have lesser copays for services and doctor visits and things like that. So it is just all about, talking to an agent and just kind of seeing what's right for you. And I think the biggest thing too there is kind of like, when it comes to having that employer coverage and transitioning into the Medicare side of things, a lot of people hear, a bunch of different things about late enrollment penalties. And I think that's a question that we hear a lot too. There's Part B late enrollment penalties, there's Part D late enrollment penalties. So do you kind of want to touch on some of those penalties and how they work?
Absolutely. For Part B, you want to get your Part B set up once you turn 65 or have that credible coverage. And if you don't, for every 12 months that you don't have Part B or you don't have that credible coverage, they give you a late penalty of 10%
Wow.
for every 12 months that you do not have that. And that penalty stays on there for life. So it's
Mm.
10% of that premium.
So it's
Like,
very important then that you sign up when you become eligible. That way you don't incur that late enrollment penalty.
exactly. And then there's the Part D enrollment penalty, which again, it's all about having that credible prescription drug coverage. So if you have one that is as good as Medicare's, then you're perfectly fine. But if you don't have anything, you want to make sure you get that Part D set up because for every month that you do not have it, you incur a 1% penalty of the national average, which right now is, I believe, what, 29 cents, 39 cents a
Believe so,
month,
yes. I believe
basically.
30 cents.
30 cents, and that for every month it compiles, and
Mhm.
you're paying that. So for some people, it might only be a few months. They might only see that, you know, $4 a month.
Mhm.
Some people, if it goes longer, I've seen people that have 60, 70, 80, whatever that many months of no Part D coverage.
Yeah, and that's
And
what I was gonna touch on is, I actually just talked to somebody the other week, and they went 120 months without any Part D coverage. So now they'll have to pay an extra 120% on that, which, just talking to an agent at that time they became eligible would have saved them from a penalty now that they'll have for the rest of their life. And so, just small things like that, just talking to an agent, just ensuring that you are signing up for these, coverages when you become eligible. Way you aren't paying this penalty for the rest of your life.
And if you don't sign up right when you become eligible, you have a couple opportunities to sign up.
Mhm.
The biggest opportunity to sign up for your Medicare is the annual enrollment period. That's October 15th through December 7th of each year. And that's where these people have the ability to pick out a new plan, to speak to somebody, to get some information and figure out what direction they want to go. And then there's the open enrollment period, which follows that, which is going to be January 1st through the end of March. And there you have the opportunity to make a one time change just in case the plan you picked out you didn't like. Or maybe if you already have a plan and you just didn't think you needed to change it back in the annual enrollment period, but now you're in open enrollment, you say, wait, my needs have changed. You have that opportunity to make a one time change. And outside of that, you would need something that is known as a special enrollment period, right, Sean?
Yeah, so if you were outside of either of those periods, the annual enrollment period, obviously October 15th through December 7th, or the open enrollment period, the January 1st through March 31st, if you're outside of that period and you're considering changing your plan or just, reviewing your options, you will need what's known as a special enrollment period. And, we get a lot of questions of, oh, how do I know if I'm eligible to use a special enrollment period? I think that's where talking to an agent really comes into play because we know, when to use special enrollment periods and, who's eligible for certain things like that. So, just to give you an example, there's a couple ones as if somebody moves, you have the opportunity to, choose a new plan. There are some things like loss of employer coverage. So for some reason you lost your employer coverage and now you have no coverage, that's a special enrollment period that allows you to get on a Medicare Advantage plan. So there's a lot of different, special enrollment periods that you can actually use. And I think just talking to an agent and seeing, if you could use one of those to potentially change your plan or just review is very important.
Other ones include if they have a loss, a gain, or a change to their low income subsidy
Mm,
level, if they have a loss, a gain, or change to their Medicaid status,
hmm
or even if there was some kind of natural disaster in their area. Those are all opportunities that they would have to help them make that change. Now, you don't want to just jump around plans, but if it's
hmm
something you truly need to do, there are opportunities out there to help you. Maybe you just missed everything. Maybe you weren't
hmm
aware because a lot of people they just aren't familiar with how Medicare works. So those are like those little buddies on the side to say, "Hey, we can still get you set. We'll help you out. We'll get you
hmm
taken care of today."
Yeah, and just like you were saying, like one with those periods that allow you to change, like the annual enrollment period and open enrollment period, that's exactly what they let you to do. So, just because you pick a plan doesn't mean that you're stuck or, have to stay in this plan forever. There are opportunities, like you said, with annual enrollment period and open enrollment period. And even if you're outside that period and, maybe you, like you said, your needs have changed, maybe there's been new medications that you've taken on that now aren't covered under your plan, you can talk to us and we can help you use a special enrollment period in order to, change your plan to something more comprehensive coverage wise. So, it's nice that people aren't locked into a certain plan, and like you said, you don't want to jump around from plan to plan, but you do want to make sure that the plan you're on is the most comprehensive coverage that you can get. So it's very important there.
And so once I have my Medicare plan, Now I have to look at my prescriptions.
Mhm.
So, are my prescription medications covered by Medicare, or do I have to go get an additional plan to help cover that?
Yeah, and that's a great question. When it comes to Medicare Advantage, there's usually, two types of plans we look at. Just standard Medicare Advantage, which would not have that prescription drug coverage like you were talking about, or Medicare Advantage prescription drug plans, which would include that prescription coverage. Now, with the medications, obviously it is all, individual dependent. Some plans may cover this medication, some plans may not. And so again, to reiterate, talking to an agent, it is very important that you talk to one of us and, we can help this, figure out whether or not a plan covers the medications that you need.
I recently had a woman call into me. She had gone to the pharmacy and they were saying one of her medications was going to be just over $600 for the month,
Wow.
and she couldn't pay that. But I did find another option for her that they did have that medication on their formulary.
Mm,
And so instead of being $600, it was gonna be about 80% less. I think it was about
wow.
120, which huge difference
Wow.
on a
Yeah.
monthly basis. And I love when we can find those opportunities for people and help them. That's why it's so great to talk to an agent and let them know about your medications, because then they can look at the formularies. They can see what's gonna be covered where. Because when we can take somebody's drug costs and cut it 80%, that's all money back in their pocket at
All
that
money.
point.
Yep.
Or there's times where people are just leaving their prescriptions just on the counter because they can't buy them. And so that's
Yeah.
quality of life right there.
Yeah, I've actually talked to a lot of individuals that they unfortunately just stopped taking the medication because they can't afford it. Whether the new year came up and their plan has changed now, where, at one point it was covered that medication and now it's not, regardless of the situation there, not being able to take a medication because it's not covered and you're scared that you can't pay for it. That's not what we want at all. You know what I mean? So that's again what you said, talking to an agent, just, you know, letting us help you find a plan that actually does cover those medications for you. And like you said, saving, tons of money. That individual that you spoke to, I mean, you saved her almost $500 a month just on her medications alone. So, just small things like that can actually really help people's quality of life.
But then they get concerned because, okay, so this plan we're talking about with XYZ carrier, so they cover my medications, cool. But how do I know my doctors are going to accept this new plan?
hmm And that's another thing that we see. You want to make sure that you still see the doctors that you care about. You know what I mean? If you've had a doctor for 5, 10, whatever years, you want to be able to still see him. And again, that comes back to talking to an agent. Tools that we use help, us see whether or not your doctor is in network with a certain carrier or out of network. So it's really just important that, you do talk to an agent and let them know who your doctor is. And obviously, we can see whether or not that doctor is accepted with this carrier, whether he's in or out of network. And it just helps us, do our job better and find a plan that's actually tailored to your needs.
And frankly, a really good thing to let an agent know is if you love your doctor,
hmm
you don't want to change from that doctor. You want to make sure you stay with that doctor. Because if you love your doctor, you don't want to change that. And a good agent's not going to want to change that either.
hmm
But if they're a new doctor, you've seen him a time or two, or you could just go for a different doctor, it really doesn't matter to you. Make sure an agent knows that, because there might be other opportunities available for things that your current doctor is just out of network on. But a new doctor would be a network, but you'd see these benefits or maybe these formularies change. So really just tell an agent your story. Tell them the doctors you see and the doctors you love, the doctors you're indifferent about, and you'll work together and make sure that whatever you're looking at is going to be so comprehensive for your health and your wallet. And if there's a doctor you love, that you can continue to see them. I
hmm
actually recently had a guy I was on the phone with, and he didn't like his new doctor. His insurance had changed. His last doctor didn't accept his insurance anymore. And so he said, okay, well, I'll need a new doctor. So I said, no problem. And I went into the search and I started to kind of break down where we might be able to find a doctor and see what's close. And I looked at a list of names, and when you see a list of names, there's only so much difference.
hmm
And I just mentioned to him, "How does this name sound?" And he paused and he said, "Are you kidding me?" He said, "That was my old doctor that I had to stop seeing."
Oh,
He was about to
wow.
start crying. He was that excited. He was gonna call her to make sure she knew. He was so excited, and I was so excited in that moment
Wow.
because he was so happy that this doctor he'd seen for so long that he loved, that he thought he couldn't see anymore because she wasn't in network, was in network with this insurance that I had found, and he was over the moon.
Wow. And it's exactly what you were saying. Like any information that you give us is going to help us do our job. You know, whether you like this doctor, whether you love this doctor, you know, like Josh was saying, if there's a certain benefit that is going to help you out, but you have to change your doctor, and we know that you love your doctor, we're probably not even going to talk to you about it just because we know that, you know, you don't want to have to change doctors. Whereas, you know, the individual you were just talking about, he unfortunately had to change his doctor to a new doctor that he didn't really, you know, care too much for. But then you were actually able to find him that old doctor. And, you know, even just small things like that really help people. And so now he can go back to the doctor that he's comfortable with, that he, you know, he's known for so long. And it's just small things like that. You know, all the information that you give helps us regardless.
And if you have a dentist you love, if you have an eye doctor you love, if you have a hearing doctor you love, make sure you tell an agent about those as well because it's not just about your primary doctors or it's not just about a cardiovascular doctor. It's about everybody in your healthcare. And so it's important to know if your dentist will accept the insurance because a lot of people wonder, will Medicare cover dental? Will it cover vision? And will it cover hearing? And a lot of the options in Medicare Advantage do.
Yeah, and you know, to touch on that as well, like you said, almost all of the Medicare options as far as Advantage side of things go, for the most part, they do cover dental, vision, hearing. Obviously, you know, every plan is different. Certain plans give different allowances. They cover different procedures for those, you know, services. But most of the plans that we look at do offer dental, vision, and hearing. And like you were saying with the doctors, you know, it's very important that if you are talking to an agent to let us know, hey, you know, my dental needs are here. You know, I need dentures within the next 3 months, or for vision, you know, I have to have cataract surgery, you know, coming up here. That's all great information for us because then that lets us know, hey, you know, we want to find a plan that hopefully covers this, you know, dentures or cataract surgery, whatever it is, you know, really helps us kind of narrow down the options and find a plan that is tailored for you.
And it's so important to give us all that information because if we find a plan that everything else looks great, but that dental is only 500 for dental, because most of them have an amount on them. And if it's 500 for dental, that's only going to help somebody so much that
Hmm.
needs dentures and all the
Yeah,
prep
it's
that
not going to
goes
cover
with that.
dentures.
No. So it's important to say, hey, I actually need to get dentures this year
Hmm.
because then we can focus on plans that have that denture coverage. And the amount of times I've been able to find somebody something that will cover dentures for them, and they haven't even been able to eat properly because they
Mm.
needed new dentures. They weren't fitting. They basically were trying to force themselves onto a liquid diet to make it work. So tell us every little detail. Nothing's too TMI,
Yeah,
honestly.
not when it comes to Medicare and your health.
Mhm.
You know, in the same way that you would tell all this information to your doctor, very similar, you know, not like you said, nothing is TMI. We want to know these things. We want to know how your health is. And like you were saying with dental, there's been plenty of times where I'm talking to someone and, you know, the other options in their area just don't really make sense for what they'd have to give up for what they're getting. But then, you know, upon talking a little more and, you know, just asking a couple of, you know, what they need, you know, discovering that, oh, they need dentures. You know, I've actually been able to go from not thinking I can help somebody to actually, you know, really helping somebody, getting them $0 copays for dentures and just small things like that. You know, you go from not thinking you can't help someone to actually, you know, really helping them and saving them thousands for things like those. So dental, vision, hearing, you know, all the information again, any information is going to help us tremendously.
And if someone is on a supplement and they want dental, vision, hearing, now supplement plans with Medicare typically do not include coverage for dental and vision and hearing, but that's why there are additional plans available for specifically dental, vision, and hearing that you can get that we can help you with. That if that coverage is important to you, if you have a supplement but you need dentures or you want to make sure you can get your eyes checked, that these different benefits, these different plans will assist with that. So again, it's all about tailor fitting your care to you.
Exactly. And yeah, to touch, you know, a little more on that dental vision hearing with the supplement. And when we say Medicare supplement, you might know it as Medigap. You know, it basically just covers the gaps that original Medicare has. So, like Josh was saying, you know, that doesn't include dental, vision, hearing. So if those are needs, dental, vision, hearing, whatever it may be, let us know that. And, regardless if you're on a supplement or an advantage, it gives us the tools necessary. With supplement, we can look at additional dental, vision, and hearing options for you. With advantage, like I was saying, we can find plans that offer what you need. So, it is really just important, kind of given the information and going back and forth with us on that.
And with those premiums, how much do you think somebody can expect to be paying for their Medicare every month?
Yeah. So it is different between the two options. Advantage versus the Medigap or supplement side. A lot of times with Advantage, like you were saying, it is going to be $0 monthly premiums to the plan themselves. Now, regardless if you choose Advantage or supplement, you are still going to have that Part B premium, the $202 that we touched on earlier. But like I said, with Advantage, you're usually going to see $0 premiums for the plans, whereas supplement, you could see anywhere from $100 up to $300 a month, depending on the type of coverage that you select. So, it does vary between the two. But what I will say is, Advantage is usually $0, whereas supplement is usually, anywhere from about $100 to $300 for that coverage.
Okay, so what happens if I pick the wrong plan for me, or if I think something's right, but then my needs change and I
Mhm.
need a different type of coverage?
Yeah. The nice thing is you don't have to be worried about being locked in or, stuck in a plan. Like we talked about earlier, the annual enrollment period allows you to make a change. Same with the open enrollment period that allows you to make a one-time change. And then even outside those periods, we touched on the special enrollment periods, which, certain circumstances allow you to make changes. So no, if you pick the wrong plan or your needs have changed during the year, don't worry about being stuck in a plan. Call us. We can, help you as best as we can. Maybe we can find one of those special enrollment periods, or if you're within that time frame of the annual enrollment period or open enrollment period, we can help you as well. So,
Especially if you reach out to somebody here at the Medicare team, we want to get to know you and we want to know what your needs are and how we can help you today. We don't want to have to wait for months down the road. So if there's a way that we can help you today, we will, but we're going to explain everything. We're going to communicate everything and make sure that you understand and are as confident in what we're talking about as we are.
yep. And that's the biggest thing, like you were saying, Josh, is just going back and forth. We are building a relationship with individuals, and this isn't going to be just one call and you'll never hear from us again. In that annual enrollment period come October, we are going to do an annual review with you and just make sure that, have your needs changed at all? Do you need different benefits? Is everything still the same? And, there's a lot of different options come those times of year. So it is really just important to, talk to an agent and, just build a relationship with them. Go back and forth, let them know of your needs, any procedures coming up in the future, needs changing, stuff like that.
So to speak with one of our licensed agents, feel free to give us a call at 717-807-7649. We're here and we're ready to help you with everything that you have questions for. But for now, thank you so much for tuning in to the Medicare Team podcast. My name is Josh.
My name is Sean.
We'll see you guys next time.
Bye bye.